So having heard last year about what various arms of the healthcare industry need and want, today is really about continuing that discussion. And it's also about asking what you can do and what you are doing to actually make it happen.
We need culture change, both you and us, that we need to do things differently and that we need to do them together. And so we've worked quite a lot on that journey. We're actually sharing our business a lot more, apart from the whole university being engaged with our major partners like out at Westmead and many other places. The faculty actually is sharing business. We are on your strategic committees, you are on our strategic committees. We're working with you to design new models of education.
Every time we make improvements in health, there are other consequences. In the emergency departments within my district, the people who are presenting aren't just older people. They are people who 5 years ago would not be alive.
It's about devolution, about getting people part of a team prepared to speak out and coming up with ideas. That applies to students, very old and bold clinicians, and so we've got people now excited about the prospect of being engaged in this change in the system.
We have to produce people who can think critically, who can communicate effectively both orally and in writing, who can work in teams, who can work across disciplines and who can solve real-world problems.
To some extent, the challenges come from our partners wanting to be on this journey with us, because otherwise we're doing creative things and planning for the future, but they go on to clinical placements where it's drummed out of them because people don't want that right now. And so the students are learning from very powerful role models in the clinics who don't want what we all know we need. And the technology uptake, I would say, is very good at a high level, but I'm not quite sure at some areas on the ground the uptake is that good.
What is the essential next step in achieving meaningful implementation of e-initiatives?
The digital native now. They are technology savvy as well. Yeah. So they are going out, if you don't do it with them, they will do it for themselves. And that's what we're dealing with in every industry.
The other thing that, particularly in public health that I think does get in the way of corporate partnerships bringing innovation is often the way we think about procurement in public health, and in any government, where there's such a desire for fairness and probity, which is very important when we're spending public money, that we tend to oftentimes come to the corporate sector when 99% of the decisions have already been made about what the answer is.
What we've tended to do is go when we've got a plan, a strategy, what we want to do, and then say, come and partner with us, rather than coming right at the beginning saying, let's talk about what the question is and what we want to do. And so we need to do that to get industry in as well, to help design new systems and effective, not just solve a problem that we've already created. We need to be using e-health, everyone agrees on that, but just remembering it's just a tool and that it should be making things better and simpler and increase the reach. When we're talking about e-health and about business, we need to understand each other. It's profit versus healthcare. We need to really think about that space and how we make it work. And we know how to have multidisciplinary conversations and we know how to have a team kind of involved at some point in healthcare. But we need to get that in the learning and also more completely out there. So I think that the final thing is that change is a given until you die, and then it stops changing. But in the words of the Vice-Chancellor, enjoy the journey. That's not just the students, that's us. We need to learn to enjoy this journey, and we need to be brave and courageous on this journey.